Hello everyone, I am Sudarshan Swai, certified prosthetist and orthotist working at Arthalife, Malaysia. Today I am going to present the advanced socket technology, which is flexible socket technology. Before going to the socket technology, the socket is a part of the prosthesis which is responsible to provide the comfortability to the patient. If the prosthesis is not provide the comfortability to the patient will not use or provide the complaints regarding using the prosthesis. So the socket is responsible for the comfortability to the patient, and the component is responsible for the function to the patient. Flexible socket technology is really, as a the name is showing, meaning that it's really very flexible to use for the patients and very highly comfortable. The flexible socket technology, we're using the resin, which name is Proflex resin. The Proflex resin. That's why it's named as Proflex socket. Proflex socket means the flexible socket. The socket is flexible. It is elastic, very lightweight, easy to use, durable, and waterproof. The Proflex socket is flexible. What I am showing in my hand, the socket is the Proflex socket, the flexible socket. This is lightweight. This socket we prescribe for any technology. Let's say it's a pin and lock, suction suspension, belt suspension. We can provide this socket technology. No restriction for the technology. Which technology is required? All technology we can provide the socket technology. As we know, if you go for a pin and lock suspension or suction suspension, we provide a double wall socket. Whether it is a polypropylene or carbon fiber. Carbon fiber also double wall, or polypropylene also double wall. The inner wall will be the soft liner one, which is attached to the technology, whether it is suction or the shuttle lock, pin and lock. But this technology is very good. Beauty of the socket technology, single wall socket technology, no double wall. So as that meaning, the weight of the prosthesis will be less because the socket is going to be very lightweight as compared to your double wall socket technology, whether it is pin and lock or suction suspension. And this is the elastic property of the socket. You can see I'm compressing the socket. This is the back part of the socket. This is the front of the socket. You can see the front of the socket. This is very flexible. The all breeds, major patients of the above knee, they complain the medial area, just below the ischial tuberosity area, the perineal area, the ramus area and perineal area. This is very sensitive area. So they complain about the pain. We adding the padding or soft material to provide the comfortability. But this socket technology, zero complaint. No complaint for the discomfort of this area. Because you can see, this is fully flexible. It's like you're wearing something, your cotton, flexible gel liner. Flexible completely. Ischial tuberosity area, the trimline, the brim area, you can see it's very flexible. Lateral border, same. It's very flexible. So the back of the socket, the back part of the socket, which is really rounding as per the muscle shape of the thigh. But when a patient is going to sit with a PP socket or carbon fiber socket, this area is the heart, the circular area. It's imagine if you're having a cushioning sofa or something like that, it can accommodate the shape of the socket, can go inside. If it is a hard chair, it will be difficult to sit. Like rotation of the socket will be there. That means sometimes the patient sitting the external rotation or internal rotation, because when the patient sit on the hard surface. So this back part, you can see this is compressible. If you sit in the hard surface, soft surface, no matter, it comes provide the comfortability. If a patient's long sitting, there will be no discomfort, no complaint, because this is providing the flexible, so no complaint for this. And for the elastic, what it is going to help in the elastic, because when this one is going inside also, outside also. This is, you can see, when the muscles is in active condition, the expansion, the contraction of the muscles is going to expand the volume and contract. So in a hard socket, there is no room for expand and contract. This is a rigid, full rigid round. But this socket, the beauty of the socket is it can expand, it can contract. Like if your muscles is contract, the room is there. If it is expand, it allows the expansion of the muscles. So the patient will feel comfortable during the high activities, walking, running, jogging, the patient will feel comfortability. I have recommended this socket to 2 of my patients. They're using in Malaysia. They're providing very comfort as compared to your normal PP socket or carbon fiber socket. You can see the image of the patient. I have set here. The patient is using the socket technology, and completely there is no trimline border padding. There is no padding because the patient is highly comfortable with this. No padding needed to add here. So zero complaint on the brim area. So the prescription, you can provide the lower limb amputation, upper limb amputation, below elbow, above elbow, knee disarticulation, hip disarticulation, bilateral patient. Same like for the upper limb as well. It can provide it to all activity level. There is no restriction for activity K1, K2, K3, K4. It can provide K1 to K4. No weight limit because the inside carbon structure is going to take the full body weight. So no weight limit for this patient. Thank you so much. I hope you like the socket technology.